Hi, I'm Dr. Dan from Vitamin Pro. And a couple of years ago, I did a blog talking about cardiovascular disease and some things you can do to help yourself in that category. But it's January 2018, and I think it's time for an update. And this is such an important topic that I'll have to do these periodically to give you some new information as we learn. So I bring this up because when you look at the cause of death, heart disease is number one, strokes are number two. So the combination of those is cardiovascular disease. So anything that is likely to kill you with that kind of frequency, that kind of probability, you'd think that everybody would kind of be on top of this and be working on it. If you look at the top 30 things that people are afraid of, strokes or heart disease are not on there. People are afraid of things like spiders, clowns, dentists, maybe bees, flying, things that probably are not going to hurt you, but probably somebody or you yourself are going to have to deal with strokes or heart disease one day, and you'd think that would be on the list there somewhere, at least in the top 10 for heaven's sake. So anyway, I want to shift the thinking here a little bit, and if you could think of maybe the 800,000 people who are going to have strokes this year, maybe you can think of that as that. What if that were spiders killing, biting with significant problems 800,000 people, not just a little bump, but some real disability, and maybe killing 140,000 of them, and maybe 500,000 are permanently disabled from these spider bites. So I want you to shift your fear away from things like clowns, for heaven's sakes, to something like strokes and heart disease, which are very likely going to cause some problems for you or someone you love. So there are something like 28 million people in the U.S. right now who have heart disease of some kind, and most of that, of course, is a preventable kind, not just some strange thing that some genetic problem. So if you thought of heart disease as scary clowns, so let's say that clowns killed I don't know how many people does it kill, 600,000 people a year. So let's say that clowns killed 600,000 people a year. Well, I think we'd have a national program to make sure that we were on top of that. But, we don't. So anyway, I just want to point out the inconsistency in our thinking about these things. So I want you to shift your thinking from being afraid of things like spiders and clowns and dentists to things that are really going to hurt you, like strokes and heart disease. If you do that, maybe you'll be able to make the changes that are important. For example, I know a guy quite well who ate himself into a stroke with 7-Eleven hot dogs and a big bag of Cheetos every day. So, he wasn't afraid of having a stroke. Well, now, of course, everybody around him is dealing with all the repercussions of the bad stroke that he had, and it's been 3 years and he's still like a 215-pound 4-year-old partially potty trained. So that's a kind of a scary thing, right? And so, but he wasn't afraid of those Cheetos or 7-Eleven hot dogs. So where do we go from here? Now, the experts all say that 80% of these problems could be dealt with if people would control their weight and their blood pressure. So that sounds easy enough, but if you don't have the emotional push here to make those changes, you're not going to. It's easy to say, eat more fruits and vegetables, cut back on fatty meats and that kind of thing, but if you don't have a real fear of what the repercussions are going to be, you're going to say, I love that pastrami, I'm just going to eat it anyway. So, I want you to be thinking more of, in the context of things that you are afraid of that aren't going to hurt you, to looking at that big buffet in front of you with all the fatty foods that are likely going to cause you problems, and thinking, or more likely the desserts and the carbohydrates and the donuts and things like that. So I want you to be thinking of those as the scary clowns or the scary spiders or something, instead of looking at them like those are your friends. So let's talk just a little bit about cholesterol, because obviously that's a big part of it. And I won't go into this very much because there's a lot written about it. But just so you know that people who have high cholesterol numbers, and just so you know that I understand that we don't measure cholesterol in the blood. We measure the lipoproteins, the HDL and the LDL. So, you know, there's no such thing as bad cholesterol. There's just, you know, the lipoproteins that transport the cholesterol that we're looking at. But the big problem seems to be that a lot of these lipoproteins can get oxidized. And so keeping your antioxidants up can be really important. And of course it helps if you have a good diet, because then you won't have to worry so much about antioxidants. But unfortunately, you can't just throw antioxidants at a bad diet and then expect anything to change. So that's been pretty much shown in the literature. So, you know, you're going to have to clean up your diet. And again, I'm not going to go through that in great detail because that's a whole video in itself. I just want to do kind of an overview of some things, and I just wanted to mention that. Now, if you want to do some more reading, read up on Barry Sears and his own diet, because he developed that primarily to protect himself from cardiovascular disease, and it worked quite nicely for him. So that zone diet is something that's really recommended. So just keep in mind that the oxidation of the LDL is really the problem in many cases, because that actually causes damage to the arteries. You know, it makes them less flexible. And I'll tell you why, and I think it has to do with the NO, or nitric oxide. Now that can be pronounced nitric or nitric oxide, your choice. I learned a nitric in college, so that's where I'm stuck. Most everybody else pronounces it nitric oxide, but I'm still stuck with nitric oxide. Now I do want to mention that specifically because the NO is what has been shown to keep the arteries nice and healthy. It does a couple of things. It keeps them more elastic so that as the blood pushes through, they can expand and contract the way they're supposed to. And it also helps prevent the plaque buildup, of that cholesterol buildup on your arteries, and also the hardening of the arteries, or the deposits within the artery itself. So the NO seems to be really important for that. Now, guess what? As we get older, we tend to produce less of that in our bodies. So supplementation and, of course, changes in diet become important. Now, a couple of things that you can eat. Beetroots, the nice red beetroot tends to increase that NO. But you can also do that in a powder form in capsules. Now, we've been taking a supplement called nitric oxide support by Pure Encapsulations, and that's a combination of L-arginine and L-citrulline that I really like. But we found that it actually works better if you add some beetroot powder as well, because now we have some test strips by Berkeley Life that help you to see what your NO levels are, which I recommend that you look at. Give that a try, because if your NO levels are constantly depleted, you're at a higher risk for heart disease. Now, NO is really important for a lot of reasons. We just talked about cardiovascular disease, but also if a guy's having erectile dysfunction problems, they give you Viagra for that. Viagra actually inhibits the enzyme that blocks the uptake of NO, so it keeps more of that NO in your system. That's how it works. So NO is the active ingredient really in Viagra, but you can also get the benefits by taking the L-arginine, L-citrulline combinations along with some beetroot. And we're actually looking at formulating that ourselves, because a lot of people are close to what we think the ideal formula is, but not quite. So you kind of have to use a couple of different products to get what you want there. Now also, I had an uncle who used to put nitroglycerin pills under his tongue, and of course you've probably seen people do that too, and it works quite rapidly, but also that nitroglycerin gets absorbed right into the blood vessels in your tongue and goes to your heart and helps those blood vessels dilate. So NO is just critical for so many things, and keeping that elevated will be a big factor in controlling heart disease. Now, I haven't seen a lot written about arrhythmias and nitric oxide, but we've seen here anecdotally at least that a lot of people have a much better response to arrhythmias, without medication even, if they use their NO. So that L-arginine, L-citrulline combination especially. And we're just starting to experiment with adding the beetroot powder to the L-arginine, L-citrulline for arrhythmias. So to sum this up, this is something that we've been experimenting with in our own clinic here, and we've had great results with the nitric oxide. We've seen people's arteries clear out, on carotid or abdominal ultrasounds, and looking at how much plaquing's in there, and we've seen it clear out. So this is something that's highly recommended, and I think with things like a zone diet, making sure your NO is at a decent level. Look at the Berkeley Life test strips on our website at Vitamin Pro. And of course, there's a million other things you could do. Watch your sugars and that kind of thing. And I think most of you will be able to avoid heart disease and strokes. So thanks all for listening. Hopefully that was helpful.